Hello and welcome to Tech About Town, brought to you by Communitech and Elevate IP. Today in the studio we have a awesome founder that we're going to introduce in a second, but we're recording this as usual in the Communitech Hub. I came in today. There's more walls in places there weren't walls, and now there's no walls in the places there were walls. It's really confusing. I'm probably like leaking stuff that I shouldn't leak, but they're doing a bunch of renos here and they're going to announce it soon. They'll find out. I mean, eventually, if you come here, you'll see there's like walls.
Oh, for
and
sure.
stuff.
Yeah.
But it's pretty cool. Renovations are always a pain in the neck, and it's interesting to see. I know I have a bunch of friends who work out of here for different companies, and they're like, yeah, I'm over here now. And I walked up to the third floor to look for you.
Oh, really?
And you weren't there because there's nobody.
Wow. I haven't been, unfortunately, on the third floor for a while, and I do miss my little home there. I loved it up there, my little nook.
Do you know where you're going? Kind of?
Yes.
Is it a secret?
Communitech has this thing where you have the light side and the dark side. And I'm transitioning to the dark side after this. So I don't know how excited I am about that.
Oh, like where the sun is, basically.
Where the sun is not.
Oh, the sun is not.
Where the sun is not.
Oh.
Yeah. And I'm a sunny kind of gal. So, but everyone is going to be there, which is going to be super exciting.
But it's also spring and you can sit on the patio.
100%.
So that's kind of,
Yeah.
that's kind of interesting.
Yeah. No, I'm excited. But now the marketing team sits on the first floor. And it's kind of nice. We get to see a lot more Communitech folk and a lot more founders. Speaking
of hustling, today we're excited to welcome Seun Adetunji, founder and CEO of MedInclude, a Kitchener-based health tech startup revolutionizing patient-provider communication. Seun's journey began as a teenager translating medical information for her non-English speaking grandmother, an experience that highlighted the critical gap in healthcare communication. This personal insight led her to establish MedInclude, an AI-powered platform that simplifies complex medical jargon into plain language and translates it in up to 12 languages, making healthcare information more accessible to diverse patient populations. Currently, MedInclude is collaborating with Grand River Hospital to pilot this innovative solution to a real-world setting. Seun is also a graduate of the University of Waterloo's Master of Business Entrepreneurship and Technology program and participated in Communitech Fierce Founders Intensive Track and Fast Track Health. Welcome to the show.
Thank you.
This is an exciting episode for us because you've graduated from 2 programs, which is pretty awesome to say itself. Your product is in use right now. Your solution's in use right now. Can you tell us a little bit about what MedInclude does?
Yeah, absolutely. Thank you. So MedInclude, as you rightly said, is a AI-powered technology platform that helps providers better communicate with patients by simplifying and translating medical information into multiple languages. The premise for MedInclude is that providers are super busy, as we all know. They're crunched for time, and they're supporting all kinds of patients, especially in an environment like Canada where we're so multicultural. And so what happens currently is oftentimes patients are not getting the full scope or context of medical instructions that they're being told for various reasons. Some of it because they don't understand English or speak English as a first language. Others because they're just frozen in time when they're, for instance, hearing a new diagnosis or tense about their condition and so many other reasons. And for those patients, it's super helpful to be able to go back home 2 hours later, 2 days later, and revisit that information or instruction that was shared with them. That is not something that is currently available to a lot of patients, just by virtue of the fact that right now medical information is shared verbally, and God help you, you remember it 7 days later. And so what MedInclude is doing is supporting healthcare providers at the point of care, so at clinics, hospitals, to share that information or instruction with patients in a way that, one, patients can easily understand. So we simplify to grade 5 reading level as the first step. And then, depending on what patients you're consulting with as a provider, you can take a step further and share that already simplified message in Spanish or Urdu or Tigrinya with that patient. And so what that then does is the patient is able to revisit that information or instruction and say, 7 hours later, what am I supposed to do to this wound area, and how am I supposed to redress it and whatnot. And so helping the providers to better communicate and mitigate, unnecessary hospital revisits or non-adherence because patients don't understand. And then also helping patients to get better agency over their own healthcare journey as well.
Yeah. Honestly, this is such important work. I can speak to it personally too, because my dad, he had like a journey with his healthcare. And I remember because English is his second language, it was always so hard, even for me, because I was so young then, to have to understand that information because it's, like you said, medical jargon, and then try to translate it in my language. Mm-hmm. I struggled so much, and I wish I had something like this at that time. I know I've met you on several occasions, and I kind of know the origin story or your personal experiences and how it influenced MedInclude. Can you share more about how these experiences shaped your vision for the company?
Yeah, absolutely. But thanks for sharing your own experience as well, first of all. And that's a story that is all too familiar. I, as you know, have a similar personal experience, and I hear similar stories all the time from so many people. And it's actually one of the things that makes me wonder, why aren't there like 100 different solutions tackling this right now?
Yeah.
Because 5, and I'm being conservative, 5 in 10 people have a similar story, either directly or as a caregiver to a loved one. And so for me personally, as you're aware, my grandmother had, a health journey as well, and recurring interaction with the healthcare system. And I, at that time, was a primary caregiver, and like you, would have to listen to the caregiver or the healthcare provider, internalize the information, then try my best to translate. Bear in mind, there's lots of technical words, medical jargon that I have no idea what they mean, but will try to do my best. And it was obvious the frustration that my grandmother felt, that I felt, that the healthcare provider felt as well, because there was just such a gap in the communication process. And that was decades ago. And fast forward a few years back, when I worked in healthcare with oncologists and cancer patients, all of this came flooding back because I witnessed again with the patients that I was supporting similar experiences of, just being overwhelmed with the volume of information, in addition to being groggy from medication, in addition to being tensed about their conditions. And I was almost certain, 4 years ago when we started this, that there had to be a solution out there, after my own experience several years back. And maybe these patients or oncologists just didn't know about it. And I took it upon myself to research and try to help them find what tools they could use to bridge that gap. And unfortunately, didn't come up with quite anything like I was hearing the patients and providers say they wanted.
Yeah.
And that's what really birthed the idea of MedInclude, is how can we take all of these experiences from patients, from providers, and, build something that is relevant to both parties, but also very, for lack of a better way to put it, business oriented, in that we're taking into consideration the healthcare organization as an entity. So this goes beyond just my grandmother's story or your father's story. There's so many other patients and their providers who are experiencing this on a daily basis. And so that means that there's a whole system of patients and providers that we could be supporting, and healthcare institutions who are also impacted by this, because all of this is happening within the context of healthcare institutions. And so that's why we built MedInclude, to support the providers to better support their patients and also create a better system and structure in terms of communication for healthcare institutions as well.
Yeah, this is such a good example of how tech can really bridge like a gap in a system.
Well, and even the way you talk about it as a business focus, business oriented solution. Healthcare is, at the end of the day, it still operates like a business, right? We actually had a guest on who talked about the differences in how U.S. versus Canadian healthcare operates and as a business. But in terms of Canada, we're resource limited, right? Physicians and nurses have limited time. Hospitals have limited space. I see a solution like this addressing a lot of those issues too, where as a nurse or a nurse practitioner or a physician, having to spend extra time with the patient is always great, but spending extra time with the patient trying to explain something, that there's a communication gap. And this seems to bridge that gap.
Yeah, absolutely. It does that. We've seen instances where healthcare institutions are using already strapped resources, so nurses, for instance, to bridge this gap manually. And it's always great to have human interaction within the healthcare journey. However, those resources, precious resources, nurses in this instance, can be doing something much more meaningful and helpful to the patients versus explaining, what chemotherapy means over and over again for multiple patients happening across multiple clinics at the same time. And so this is, like you said, where technology can really be that complementary platform or tool that elevates the time and resources that healthcare institutions and nurses have, and really help them focus on what's most important. We're seeing such an avalanche of healthcare tools that are powered by AI that are doing exactly that. So many tools, for instance, addressing admin workflow for healthcare providers and doctors and nurses. I think communication is the next big focus for healthcare institutions, especially when you consider in Canada and North America generally, where there's a continued cycle of newcomers who are needing support with multiple languages, where there is, an increasingly senior population, which means that we will have more patients who need additional support and are on a recurring basis with healthcare institutions. And so technology really is going to be that catalyst that helps to elevate the limited resources that we have within the healthcare system in Canada and I think North America generally.
Yeah. And I'm curious because I know that now MedInclude is being piloted, right, at Grand River. So what's that been like, and how has that kind of influenced MedInclude, and what is some feedback that
it's been a really interesting journey to partner with such a large healthcare institution. I think one of the things that it's done for us as a business, first of all, is that it helps to signal the readiness and the state of our technology. But beyond that, we've got really great feedback and insights. One of the things that partners are most wary about in terms of partnering with new technologies, how's this going to impact our current system? And that's a valid question for healthcare institutions, right? We've found with this partnership that's ongoing with Grand River that there's been little to no disruption to the current process for providers. And so where, before now, the worry would have been how much time would this add to our workflow, or, how's it going to disrupt the current processes, and what's going to break in the system. We found that nothing has broken. I hope I don't jinx it, knock on wood. Nothing has broken so far. It's been great feedback from the providers and the patients that they've supported with the platform as well. And I think that signals to, subsequent partners that we're at the cusp of a really great change, creating new standards of communication for providers and patients. And this is really the time to get on board that train.
From a workflow standpoint, is it like the practitioner, do they record the instructions then, and then your platform lowers the reading level and translates?
That's a great question, because I always love to talk about our workflow and I could go really deep dive into how the platform works. So what you've described is one example of how providers can use it. We've built a platform that really takes, because it was co-designed with patients and providers. We've been able to build a platform that really takes into consideration the current workflow of providers. So in terms of workflow and input, providers can actually verbally record and just speak into the platform and have that simplified and translated seamlessly. All of this is done in less than 60 seconds. They can enter text if they so prefer. So in some instances, provider will have already written or typed out text on another platform that they can simply copy and paste, or type into our platform as well. They can also enter an existing document. So whether it's PDF, Word, Pages, whatever format it's in, they can upload an existing document onto our platform. So giving them a variety of ways to input whatever instruction they want to share. And then what the platform does is it does its thing in the back end and spits out the results in simplified grade 5 reading level English. And then in addition to that, if the provider wants to translate for a patient that speaks French as a primary language, they can do that as well and, get that output to the patient. What the patient says is the initial original entry, the simplified, and the translated output.
Wow.
So they're getting three, in a sense, the instruction in three different states, in its original initial state, in its simplified and translated states. And, that we found that to be the best way for providers to share, because they're retaining the integrity of the initial message. They can go back and verify. They're sure that what they're passing across is exactly what they want to.
Yeah. And you might have multiple family members too, who maybe English is their first language, maybe they have some medical training, and they're able then to see a translated, simplified text, and then also the original, and go, okay, I can give the appropriate instruction.
Absolutely. That's absolutely.
No, I was just really curious because I remember one time when you came to speak at one of our internal meetings, we talked about the evolution of like where you started versus, all the changes and then, how it came along. And I remember I really loved hearing your story and what kind of through the experience of, piloting MedInclude and just of people using it from both perspectives, like what really changed, when MedInclude just started, did you have these kind of 3 states or was it something different or?
Oh, no, we did not have 3 states when we started. We've come a ways for sure. We've been fortunate to, live and work within this wonderful Waterloo ecosystem where there's so much opportunity to partner and collaborate and learn. And that's exactly what we've done. As we've taken advantage of opportunities within Communitech and outside of Communitech as well. The university has been very supportive, Grand River Hospital, and so we've co-designed the platform design and its structure from inception with providers, patients, and healthcare administrators. At the time that we first started with our initial MVP, really buggy platform, we worked with about 50 doctors at that time and their patients to trial the MVP, and we got such valuable insights. One of the actually two things that were really important out of that initial pilot back in 2023 was one, provider said to us, this is a great tool, but if it adds even 5 minutes to my workflow, I won't use it.
Okay.
And so that was very instructive for us, is we need to build something that enhances and complements the current workflow without adding unnecessary steps. And so the initial MVP that we had, actually, we had so many bells and whistles, really focusing on the design and the brand and the tone and how beautiful it looked and navigating from here to there. And the provider said to us, this is too much. I want to go in, do what I need to do with as minimal clicks as possible and get out. And so we went back and modified the platform and, took out all of the bells and whistles and really made it functional. So this is not, we're not going to be contesting for the prettiest platform is what I'm saying. It's very functional. You go in, you click the one button, and then you get an output of what you want in less than 60 seconds. So that was very helpful, that co-design process to build what the structure looks like. The second really important insights from that initial set of trials with providers was what the output of the platform itself would be. So at that point with the MVP, we had just the text function.
Okay.
And so they said to us, well, text is great, but I don't want to type.
I
don't have the time to do that. Sometimes I might have the instructions somewhere and I can copy and paste, but in most instances I don't. And I don't want to have to type it. And so they said to us, we have existing documents in English that are for patient education. I would love to be able to upload that. I want to speak into the platform as I'm speaking to my patients and not have to repeat myself, and have the platform capture that, simplify, and translate. And so we took that feedback and rolled it back into the platform, and now we have those features. The part B of that is they said to us, we also have patients who, in addition to not, speaking English as a primary language, cannot also read in their primary language. Okay. So they can't read French. They speak French, they speak Urdu, but they can't read it. So this is technically useless to them in paper output. And so we took that feedback as well and built into the platform a text-to-voice option so that the patients can have the output read to them. And, so in cases where the patient is taking this back and they have a child, like you said, or a brother or any loved one who speaks and understands English or has some medical background, they said to us they would like to be able to see the progression of the information. So initial state, simplified, and translated state. So we took that feedback as well and rolled it into the platform, which is where we now have the 3 stages of information that can be read out verbally to the patient in their preferred language, and also a more simplified workflow for the providers as well. So it's really been a journey of slowly progressing to, I want to say final state, but I also know there's a final state.
Yeah.
Yeah.
Well, I was going to say too, like you talked about the evolution of the platform, right?
Yeah.
Based on provider feedback and patient feedback. Your partnership with Grand River has probably given you some feedback too. And now you'd mentioned earlier, paramedics is another avenue, and maybe not wasn't something that was originally part of your plan.
Yeah, no, absolutely. I mean, one of the things that we're finding out of working with Grand River Hospital is our platform really does, and this is the thing with tech, right? You create technology to solve something without necessarily having a view of what the cascade effects will be across, other scenarios. And one of the things that we're seeing is the platform really comes in handy in those situations where seconds matter. And so you're in an emergency situation with this patient, you need to understand where they're feeling pain, what medications they're currently taking, so you can properly administer, a new medication to them and whatnot. But they don't speak English and you don't speak Urdu. Seconds matter, right? In life-saving situations such as those. And we thought to ourselves, well, in what other instances do seconds matter? And paramedics is... EMS situations and emergency situations are one of those instances where seconds matter as well. And we actually had a paramedic unit reach out to us and said, we love what you're doing, would love to explore a partnership and see how we can integrate into our current workflow and work with you folks. And so that definitely is another extension of our current focus that we're now exploring to say, how else might we leverage what we've built to help other kinds of healthcare providers beyond doctors in the clinic? So thinking beyond, the hospitals and the clinics to say, what else is out there? Where else are other healthcare providers supporting patients within the communities, and how can we support the work that they're already doing? And so hence, working with these paramedic units and then exploring collaboration with others as well.
That's cool. I'd be remiss if I didn't ask you. You've gone through multiple programs. University of Waterloo, here at Communitech. You've probably spoken with a bunch of other founders. What advice do you have for founders? Because you're 4 years in, right? So looking back now, 4 years, founders who are kind of coming up now with an idea, kind of similar journey. What advice do you have for them?
Ooh.
Loaded question.
Yeah, I know.
As long as it's like, don't do it. Like, that's not the advice we want to give out.
Definitely do it. For sure, definitely do it. I think one of the things, I don't know if it's an advice, but just from my own experience that I like to share is don't be afraid to look stupid or ask
Love that.
what you might think are stupid questions. That literally is the way that you create and innovate, is by being curious and poking at what is seemingly obvious to say what's beneath this and why or why not. I think that for me has really been what what drives me and what keeps driving me as a founder is, I don't care. I'm not afraid to look stupid. Yeah. I think that's a really helpful mindset for founders to have.
What kind of stuff? Like, it goes back to what you said when you originally had the idea. You thought there'd be 1,000 other versions of this already.
Yeah.
And it's attacking that. It sounds so simple, and yet no solution existed.
Absolutely.
Yeah. It's also like usually in scenarios where you think that you're the only one with that question, where you're the only one with that curiosity, there's probably thousands of people with the exact same question, exact same curiosity. So
absolutely. I think in an inverse way, it's a really brave thing to do, to have an idea and you know, give yourself permission to have the audacity to go out and
I love
say,
that. Yeah.
I'm going to try at this. And, you know, yeah.
Well, it's just, I mean, I think we need more people who will just throw something against the wall and see if it sticks and then keep going.
Yeah. I mean, I know that's not usually the advice, like you've got to get a strategy and whatnot, but with innovation and entrepreneurship, like sometimes you really just have to go in blind and do your best every day and, you know, work at it. You'd be surprised where the journey takes you in terms of just the curves and the loops. It's never a straight journey, as I'm sure you folks know. You talk to so many founders. So it really sometimes it's about trying things and seeing what sticks.
Yeah. No, fair.
Awesome. Well, thank you so much for joining us today. Like this was.
Yeah.
Absolutely. Thank you for having me.
We wish you all the best of luck.
Thank you.
And I'm sure we'll see you around town.
You bet.
Yeah. I'm excited to see you again. I know I will.
Yeah. Thank you so much. I always love interacting with community tech. I'll be working here for the rest of the day. So
Even better.
yeah.
Nice. Well, thanks again.
Thank you.
That was an inspiring episode. I know I say it often, but it was.
No, I honestly, I've had the privilege of meeting her and talking to her a bunch of times, and I really wish this tool existed back in 2014. I would have loved.
But it's an interesting thing. Like you brought up the scenario with your dad, where English isn't his first language and trying to understand things. And I remember, like, I had a kid who had a medical thing, and they would give us the instructions. We had to give her injections for like 2 months after she was born. And I was like, I've never given injections. Like every time I did it, I felt like I was a scene in Pulp Fiction where I'm just like looking for like the sternum and, you know, and it was an injection into her leg. It wasn't Pulp Fiction level. Do you get that reference?
Yeah,
okay.
Sort of. Yeah. Well, the
generational gap.
There is a generational gap. But Alex, you also, you know a reference to everything somehow. You're
old
like,
and I've seen a bunch of things.
No,
I mean,
you're
it's just
like
kind
a
of the nature.
Dictionary combined with like an encyclopedia and like a chat GPT, but in real life.
My wife said I just spent a lot of time on the internet.
You do. You're fortunate enough to, I feel like, also work with all age groups. So you, whenever I tell you something, you know about it. And I love that about you.
I got side eye because we, from a 12-year-old, because we were at hockey and they all got hoodies.
Okay.
They went to provincials, Air Rockets, U13B, provincials. And I was like, oh, look at this new drip. And the one girl just looked up at me and was just like, Murr. And I'm just like, I can say it. Now it's not cool.
Yeah. You literally just made it uncool.
I know this is the end of this episode and hopefully it airs sooner than later. The Ice Bucket Challenge is back. Have you seen this?
I did. I did see it.
What on God's earth is happening?
I don't know. I actually saw I saw it in action. So
I saw it in action yesterday when my kids were doing it. They're like, I got to do the Ice Bucket Challenge and I got to figure out who to. I'm like, did I time travel? Like in a bad way? Like not to anywhere fun, but
things always come around.
To 2014. Yeah, it's like some other charity. I don't even know what charity it is, but they're nominating like 3 people.
Yeah.
And I'm like, no, but you're just supposed to nominate 1 person. Like if you nominate 3 people, like it just seems weird.
I nominated 3 back in the day.
Did you?
Yeah. I
thought it was just
all
1.
these people do it.
You know what? Maybe I just don't remember.
Yeah, maybe not.
Doing it. I also don't want to go find mine. I'm sure it exists.
Yeah.
On some SD card.
I'm a good detective. Oh, it's not online?
I don't know what I would have done it on. Like if it was Twitter, no. And it wasn't Instagram. Oh.
Instagram.
It could have been Instagram.
Yeah.
But I also like deleted I was prone to delete an Instagram account back in the day.
Well, you never want to do that. You need like an archive of stuff.
No, it's good to forget things. Anyways, that's good. So this episode, just as a reminder, is brought to you by Communitech and Elevate IP. Elevate IP is currently in its fiscal year cohort thing. I'm not exactly sure, but why don't we just take a second before we leave and listen to an IP minute with our friend Alexis Conrad.
So one of the most common questions that I'm seeing come across our desk at Elevate IP right now, it has nothing to do with patents. It has to do with trademarks. For some reason, we've got a wave of companies that are reaching out and saying, hey, I'm incorporated under this name. I received a cease and desist letter, or I found a company that seems to be using a similar name in our industry. And they're under the assumption that they have the right to be using that name as a trademark. And sometimes they might from common law use, but not always. There's this educational gap. And I've seen companies within the last month that have basically been told by their service provider, you can't use that trademark. You are in a situation where you are infringing on someone else's mark in a couple of jurisdictions. And your easiest course of action at this time, because they're not willing to move on the ownership of those trademarks, is to completely rebrand. So because for whatever reason, a founder's missed out on some education about trademark searching, which could have been done for just a few $1,000s, they've landed themselves with a legal expense to manage and respond to a cease and desist, but also now with this huge expense of a rebrand. And it could have been prevented. You know, we've got programs like Elevate IP. We have IPON, for example. We have the National Research Council in Canada that has some IP programming and a ton of resources online. But for some reason, there are companies that maybe incorporated early on in the pandemic that completely missed the trademark bus. And it's kind of coming home to roost now.
Thank you, Alexis, for your IP stories from the ground. We'll have more with Alexis coming up in future episodes. And as always, if you want to learn anything about any Communitech program or Elevate IP, you can visit communitech.ca, or you can follow them on all of the major social media platforms. Thank you as always for listening, and we'll talk to you soon.
Bye.